Hi everyone, Dr. Jeff here today. Common question I get in the office is, when do I take Tylenol? When do I take Advil? What does aspirin do? Well, Tylenol is actually a antipyretic and for fever, and for pain. So it's really good if your kid is sick and has a fever, or you have a fever. It's really good for lowering their temperature. It's also very good for pain. Problem with Tylenol is very hard on your liver. It's the #1 cause of liver failure in Canada. The good thing about Tylenol is it doesn't affect your stomach at all. If you're pregnant, if you're breastfeeding, you can take Tylenol. There's no research showing that it's harmful to you or your fetus. So Tylenol is really good for fever and for pain. Advil, on the other hand, Advil is actually an anti-inflammatory. It's part of something called an NSAID, or non-steroidal anti-inflammatory, very similar to Aleve and Naproxen and Celebrex and those types of drugs. Now, Advil you're not supposed to take if you're under 15 years of age. Advil is very hard on your stomach, #1 cause of ulcers in your stomach. It's really good for inflammation and for pain. So if you sprain your knee or you sprain your ankle and you need something to reduce inflammation and decrease the pain, that's what Advil and Aleve would be for. Right. Aspirin's been around forever. Your Bayer aspirin. It actually has anti-inflammatory properties very similar to Advil. As far as a pain reliever and anti-inflammatory, it's not as good an anti-inflammatory as Advil or Aleve is. But the thing with aspirin, it does have a blood thinning property in it. So as the commercial often says, if you think you're having a heart attack, call 911 and chew 2 baby aspirins. The idea is the aspirins will help you reduce the clot. But aspirin, on the other hand, as well as Advil, are very hard on your stomach. #1 cause of ulcers in your stomach. So you have to watch how often you take these. Advil and aspirin are also very hard on your kidneys and your liver as well. So if you're taking these medications, Tylenol you can take. There's no real problem if you're pregnant or breastfeeding. Good for fever and pain. Advil, very hard on your stomach. Always take it with food. Don't take it if you're under 15. Very good anti-inflammatory pain reliever. Aspirin, same as Aleve, not as good anti-inflammatory, but has the blood thinning properties in it. So that's what Tylenol, Advil, and aspirin are for. If you have any questions, you can always send me an email here at jgoldsworthy@goldsworthywellness.com. I'm Dr. Jeff, and I've got your back.